we need health insurance reform now. And this week this last month we had, let's get it done, right? Let's get it done, let's get health insurance now. We've been collecting declarations since June 6th, and we've collected thousands of declarations in Congressman Klein's district, as well as over 1 million in the whole entire country. We've held over 12,000 healthcare related events in over 2,500 communities in all 50 states in every single congressional district.
Again, my name is Tony Rosenberg, and I am approaching 65 on January 1st. I am concerned for my children and my grandchildren and your children and your grandchildren, because they too are exposed to what we now call and have been calling for many, many years pre-existing condition. The problem with having a pre-existing condition is, like my granddaughter, she has inherited some of the problems that I have, her grandfather, her mother, and other family members. So now she is considered at age 6 under the care of pre-existing condition. When we say pre-existing condition, it's not about us. It's about our children and our grandchildren and the future of this country and their children.
I'm Al DeMeo, professor of political science emeritus from Brooklyn, from Long Island University, Brooklyn, New York. Came to Fort Lauderdale 4 years ago. So I'm going to profess a little bit. Can't avoid that. And when I think of healthcare or education, you know that the Declaration of Independence, all men are created equal, just slaps me in the face over and over again. What it means to me, what it's meant to the development of the country, and what it means in this healthcare debate. The statement is a statement of a fundamental belief in the value and the dignity of every single human being. It's the core of why we're a decent country. It's the core of our decency as a country. We've had to struggle, and we continue to struggle to realize that promise and that pledge, that challenge. All persons are created equal, whether it's racial equality or gender equality, ethnicity, sexual orientation, or disabilities. The challenge is to act in a way to fulfill those promises, to pledge all persons created equal with those fundamental and inalienable rights, life, liberty, and pursuit of happiness. So the current phase of the struggle concerning health for all Americans in the United States really relates to this issue. Are we going to be true to that core value, all persons are created equal? Because the health care of Americans is profoundly a moral issue. Above all, it's a moral issue of how a decent, democratic society lives up to its promises, how it keeps on respecting the dignity of all its people. Affordable health care for all is a matter of social justice, and we've got to say that. So why is it that seniors, ironically, are the ones who express such deep concerns, worry, even discuss perhaps the most mistrust in discussions of healthcare reform? Some may be vulnerable to the 24/7 news cycle, the nonsense that has led them to believe that healthcare reform is going to weaken or undermine Medicare. They've used that term Obamacare as a negative to be undermining of Medicare. Even the good old bugaboo that you can drag out whenever you want to stop socialism has raised its ugly head. What absolute nonsense. But to the contrary, you know, because you've informed yourself, that the current health care reform bill that's passed the House of Representatives and seems to be the areas focused in the Senate, specifically looks to improve Medicare efficiencies by eliminating administrative waste, freeing up billions that will help seniors by ending taxpayer subsidies to insurance companies. And with those freed up funds, seniors will no longer be paying those co-payments for primary care. There'll be no out-of-pocket expenses for checkups. Seniors continue to see their doctors. That infamous donut hole, and that's a main concern to me, in those covered by the Medicare Part D prescription drug care will begin to close and eventually be eliminated by 2023. These reforms are going to extend Medicare, make the fund solvency, solvent from 2017 to 2023, and the rate of increase in Medicare Part fees will be slow. All of those changes are designed to make Medicare more secure and actually to expand benefits from seniors. We need a health care reform that covers all of us, therefore that expands choice to all, reduces costs by including a strong public insurance option with real incentive for cost reductions. Just to repeat some: coverage and affordability for all, no exclusion for existing conditions, no cancellation for sickness, no loss with change of job, no gender discrimination. Congress, we've got to tell them today and over, get the job done, live up to the promise, live up to the pledge. Thank you.
But you're, yeah. Just get started. Exactly. Good morning. Good morning. Kind of. Yeah, they are.
Hi, Felicia Goldstein, I'm the district director. Hi.
These are all constituents of Congressman
Hi.
Klein.
Hi. Hi, sir. Hi, how are you? Hi.
I'm Mike Coleman.
Hi, Mr. Cohen. Hi, come.
Hi, I'm Laura Walton.
Come right in. Come right in.
Good morning, I'm Dina Heffernan.
Hi. Hi, sir.
Okay, well, we're here, obviously, we're showing our support for healthcare insurance reform now. Everyone here has a stack of declarations, people that declare their support for the three principles the president wants. And we're here to give it to you, let you know that the constituents of this district would like healthcare reform, that when you go to DC, that we want to make sure on their behalf.
Absolutely, I'll make sure he sees all of them.
And I want to make sure that, we talked this before, that he understands this is the prime moral issue facing the country, that's got to, and public interest has to be above every other interest, insurance company, everything else. That's critical. And we need a public choice to discipline the process.
I'll make sure I give him that information, sir. Congressman is continuing to listen to his constituents. He's been doing that since April. Before this all became something that everyone was doing even more so, he served in the State Senate on the Health Care Committee while he was there. So this is clearly something that's been near and dear to his heart, health care. And I'll be happy to make sure he gets all of your concerns and hears from you, and we'll be in touch, I'm sure, in the next few weeks as they go back to DC and listen to the president on Wednesday.
We would like him to take a leadership role.
Yes.
Right.
He hasn't done that at this point. He's not taken a stand on what's right, and we would like to see him take a stand on what's the right thing to do, not what everybody tells him to do or what the insurance company pushes him to do.
Well, just so
4128, which is a precinct in his district. We voted for him. We are excited about what he does for us, and we hope he will continue to work very hard on our behalf, particularly in the areas of healthcare as our representative. So not to be afraid.
I appreciate that. Thank you very much.
But it should take some courage. I mean, this does take courage in some ways.
It really does.
And it doesn't mean that every constituent is going to agree on everything. We may differ, but look at the public interest. What do we really need to move the country forward? That takes courage. It took courage during the Civil War. It took courage during the Civil Rights. It takes courage now. We'll support him.
Yeah,
Let's see the courage.
Okay. Thank you.
And if they would just eliminate age discrimination in Medicare, it would take care of the entire problem.
Do you know where he stands on the public option?
The public option is something that he's looking at. He continues to look at it. And again, he'll wait to hear what the president has to say, but he believes in the competition with the insurance companies and that people being able to have affordable insurance.
How does he see there will be competition without a public?
That I'll be happy to give you someone else to speak to in DC who handles his insurance. Looking forward for my daughter hearing from the president on Tuesday in her public school.
Yes, thank you. Thank you.
But I did call my school board and let them know that. She does attend public
Great.
school here in Palm Beach County.
Good for
Yep,
you.
I will
am
do the
excited
same
that
too.
she's going to hear the president tells her good education is important and she needs to stay in school.
And in this area, Frank Barbareri is the school board member.
What was
And
your
he
name?
was just elected last November, so we all should really give him a call as well too for that.
Well, I know the school board, thank you.
We campaigned for Ron Klein, so
And
he
we
should know
appreciate
that too.
that. And we hope we'll see you again out there.
That's our other big